United We Listen is a podcast of United Way of Franklin County in Pennsylvania. Our podcast is intended to provide information and entertainment, not direct medical or financial advice. We recognize that there are many providers in our community that are available to you for resources and guidance. We hope this brings you information that is helpful in your life. If you find our podcast helpful, please like, share, or subscribe, or better yet, make a donation to United Way of Franklin County to help expand our work. Welcome to United We Listen, a new podcast by United Way of Franklin County,
located in beautiful South Central Pennsylvania,
bringing you into the heart of our community's most pressing issues to provide a place where together we can really tune in and listen to people. I'm Amy Hicks.
And I'm Kelly Fraser. Each episode, we're here to connect, listen, and learn alongside you.
We'll explore topics like early education, health, and economic realities, all through the lens of those closest to the issues.
We'll hear from local experts and change makers who are working to make a difference right here in Franklin County.
Join us as we dig deep into important conversations, because when we listen, we grow stronger together. Today's a pretty exciting day at United Way of Franklin County because we're attempting our first podcast called United We Listen. In a few minutes, we're going to get focused on topic, which is all about connecting people to resources in our community and how that works. I want to give you a little framework for what to expect with our podcast. This is a project we've been working on for about 6 months. The idea behind it is to help the community connect better with us and understand the work that we're trying to do, not to mention to get to know the nonprofits we're working with. It's our way of trying to show you where the rubber hits the road. Like most projects and ideas, we called on a lot of friends to pull this together. The equipment we're using today is on loan from the Franklin County Coalition for Progress. We were trying to decide where we were going to hold the podcast. We tried several rooms at our office and ultimately decided to take this on the road. We want to show you some of the places where the work happens in our community. So as we do this, you're going to see a lot of different locations. And then trying to determine how we wanted to handle the topics. You're going to see direct conversations with people that are doing the work in our community and to help understand how you can better connect with that work and the thought process behind it. Out the gate, this is probably going to feel a little rough and it's going to feel homespun, and that's exactly what it is. But if it works, it'll give you insight into how United Way works, what we're trying to do, and to help you better connect with resources in our community. Today we're recording at Little Daisy's Closet, and we're here with founder John McCrae and his wife Kathy, who run Little Daisy's Closet, working with a lot of volunteers to make this happen. This is an opportunity for us to showcase the things that they do here. So, John and Kathy, can you tell us a little bit about what happens here?
Sure, thank you. So our mission here at Little Daisy's Closet, we're a no-charge Christian-based community outreach, and we use the generosity of the community to create fair and equitable access to clothing, diminish food insecurities, as well as help folks with a hand up out of poverty. We like to say we are not a clothing ministry that offers help, but we're a help ministry that offers clothing.
That's pretty cool. Yeah. And you've got it on your wall back there, along with numbers you're serving.
Yes.
Lots of things going on through here.
Yeah, 2023 we provided over $760,000 worth of no-charge basic needs to the community. Last year alone, we provided over $1 million worth of no-charge basic needs to the community.
Just out of curiosity, how far is your reach right now? People are coming from what areas?
So we currently do 5 counties: Franklin, Cumberland, Fulton, Adams County, and Washington County, Maryland.
Wow, people come here to get what they need.
Yes.
That's amazing.
Yeah, we're open 2 days a week. Our guests can shop from 12 to 3:45. We open an hour early for our veterans and those who have mobility issues. And like I said, they can shop twice a month.
That's pretty cool.
And if someone wants to connect with you because they want to, help or volunteer, how can they do that?
Just stop in and visit with us. We'd be glad to chat with you, and we'll get you started volunteering.
Wonderful.
Sure.
So Little Daisy's Closet's located on Orchard Drive, right next to Spiker's Appliances.
Yes, we're between Dollar General and Spiker's. That's correct. 1613 Orchard Drive. You can also get information at littledaisiescloset.org. You can follow us on Facebook at Little Daisies. And if there's a need for larger furniture, we do have Little Daisy's Closet Hope, Hope, page on Facebook. Just go in there, say what you have a need for. Someone will say, I have that. Make the connection that way.
Gotcha.
Cool.
Yeah.
All right. Thank you. Welcome, Desi and Melissa. How are you all doing today?
I'm doing good. Thank
Good.
you for having us.
We're glad you're here. So let's start by just doing a quick introduction. Tell us just a little bit about what you do and where you do it.
I'll let you go first, Melissa.
Okay. I am Melissa Mattson. I am the Family Development Specialist at SCCAP, South Central Community Action Programs. I am also board president of PFLAG Chambersburg. So that's the organization that helps education and support members of the LGBTQ plus community and their allies. SCCAP helps people find a realistic path out of poverty. We have the WIC program and the food pantry and gleaning and early learning resource center and our family services program that provides a lot of rental support, and we're doing a lot of person-centered coaching now to help people not only just survive but also to thrive.
That's awesome. It's necessary.
We're all needed in the community.
Desi, how about you? Your role and what you do for the community.
Hey guys, my name is Desiree. I work for Keystone Health. I'm an outreach worker for the HIV department. I do testing and education for HIV and STDs, but I'm also a community healthcare worker. I link people to care. I help out with resources. I'm also bilingual, so I help out with applications. I translate for them. I make sure if they're needing diapers, clothes, I refer them to the right organizations. I also host health events, and that's where I bring other organizations to work with me to just provide information and educate the community. I help everybody.
That's how I got to know you.
Yes, I do.
Because the first time I talked to you, you were doing outreach to try to reach the homeless population.
Yes.
And so you wind up working with a lot of community.
Yes, I do. Everybody has my number for some reason. They do. My passion is definitely with the homeless people because I see them a lot, especially the places that I volunteer with. Little Daisies, Diaper Depot, Hungry Hearts. Anywhere in the streets that I'm working at, I'm definitely seeing the homeless people. And my heart is with them. My office is located in Main Street, downtown. It's a safe space for everyone to come in, especially for my homeless people to pick up, let's say, first aid kits, wipes, hats, gloves, coats, anything that we could provide for them. They come to the office, and it's good to see them, to see what they're up to, what's going on, if they need food, community meals, right? So it's a lot of work, but I love it.
So how do people find you?
In the
for
streets.
the first time? Okay, tell me a little more about that.
Okay, how do people find me in the Okay, so people could locate me at downtown, 51 South Main Street, or word of mouth, like Melissa. She would spread my name out. Social media, it's all about word of mouth, I have to say. A lot of my peers, a lot of my organization, call Desi, hit up Lulu, send her an email. That's how they look for me.
Are you Lulu too?
Yeah, I'm Lulu too. I have multiple names in Franklin County.
Oh, that's great. So, so when somebody connects with you and probably in need of help, what does that usually? How does that usually go? Like, how do they connect with you? What do they ask?
Right now, my biggest challenges will have to be housing. That is my biggest challenge right now, and I will have to say I can't help. But I will give out other resources. I will give out information about, like, Pennsylvania low-income housing. That's definitely one of my challenges right now is housing. I can't help. Language barriers is another thing. I wish everybody had translators, English, Spanish, and French Creole, but that is not possible. So that's another barrier, the communication between a client or a patient or an organization. informations don't get by, or they get slipped, or the client or the patients are not understanding what to do to apply to get help. So those are my challenges right now.
Are you seeing the same thing, Melissa? Any other things to add, or
Housing is a big barrier. There's just a lack of affordable housing.
Absolutely.
In Chambersburg and in Franklin County overall. And so that's just been the biggest struggle. And job-wise, too, like trying to find a job that has a livable wage, that works within the hours that you need, and also to be able to do childcare during those hours. It's a big barrier for people to even be able to maintain the rent and utilities when they're doing it. So we're seeing a lot of people who are falling behind on that. And unfortunately, we had a lot of funding over the pandemic, and that has all now ended. And so there's just not the financial resources that SCCAP was able to provide the last 4-5 years now. And so we are making this shift to this person-centered coaching where we can't necessarily financially help you, but we can help you figure out a path.
Life skills.
Yeah, to move forward. And everybody has these goals, and their families come in knowing what they want to do and where to go, but they don't know how to get there. And so we're here to help them work that out.
Yeah. The other challenge I see is a culture challenge, too. Like,
Talk a little bit about that.
all right, I have to say, people coming into Franklin County, everybody is raised different. You got your Hispanics, you got your Haitians populations, you got your blacks and your whites, but we all are raised different, trying to show the people that are coming into our community, how does Franklin County roll? We have rules, regulations, we have policies we have to abide by. They don't understand it. They want to know why. In their countries, they don't do this, but in our country, we do. We have to respect our programs. You have to be nice. You can't be greedy. If you take one is good enough for the family. It's a lot of talking, a lot of handheld. People don't like it, but what can I say? If you want these services, you got to abide by these rules. Am I right?
That's when we're all working with limited resources. And so I know as providers, we're working to spread the resources as far as we can, being practical about it. And you want to help.
Yeah, you do.
But it's helping teach people how to meet you part way, right?
Yeah.
So I want to revisit, and I might need a little editing with this.
That's okay.
When someone arrives, I'm going to use the word at your door, although it's probably not at your door. It might be on your cell phone or out in the neighborhood somewhere.
Doing groceries.
When you're at the grocery store, right, Desi? When someone arrives at your door, how does that conversation start? How does it present?
I mean, for me, a lot of times they're coming because they are in crisis, because there's a bill that has to be paid, or they're going to be homeless, or their lights are going to be shut off. And I know very little other than I have an eviction notice. So I'm like, tell me what's been going on. What made you seek out SCCAP, and how do you think we can help? And then I just let them talk. And now I write a whole bunch of notes down, because later on I'll be able to connect you to other resources that might not even be related at all to your current immediate crisis. And then we just work through that. I'll ask clarifying questions, maybe run an eligibility check so I know what programs they can apply for and where else to send them. I am very versed in the guidelines of the other programs in the area, because I don't want to send somebody to an agency that I know they're not going to qualify for, because they live in Chambersburg, and so they're not going to get resources in Waynesboro, because Waynesboro, you have to be in Waynesboro School District or Green Castle School District. And I don't want to send anybody on a wild goose chase. And then once we do that immediate crisis problem solving, we can move into the more of the I want to do X, Y, or Z and these dreams and goals that I have.
Right.
I'm a little bit different compared to Melissa. She's nice. I'm not. I'm going to be honest with you. I feel community outreach workers, it needs to be honesty and a trust right away. When someone comes at my door and asks for help, the first thing I tell them, I'm non-judgmental. I'm here to listen to you. I let them know about confidentiality and HIPAA because I want them to know I'm here for them. But I also let them know I need honesty. If you're going to lie to me, then you can't work with me. Because I'm putting my name out there. I'm referring the client or the patient to someone else. But when they come with me and they work with me and they're honest, things go smooth. If they listen to me, I guide them. I tell them where to go. It goes smooth because you're setting them up in the right path. You're telling them how to walk, how to talk, what are the questions that need to be answered for your services. It's all about how you present yourself to the agencies too. We want to help people, but we want to see the community be serious about it. You have some people that are not, and then you have some people that are really in need. So I'm a little bit picky, but I would definitely give my all, and I just want honesty. For anyone that comes in my door and asks for help, I want them to be honest.
So let's talk a little bit. What is it you really need to know?
I like to know their name, their date of birth, why they're in this town, Chambersburg, what made them bring them here. I deal with a lot of migrants. I deal with a lot of undocumented. So I need to get a little bit of history, their background history, to know where I'm going to guide them, where they need to go. My cases are different. I could get someone with HIV positive brand new into the county and they need caseworkers, they need providers, they need medication. Or I could have a mom that just had a baby and needs Pampers. I call my other organization Diaper Depot. So each case for me is different.
So what brings people to our community? I often wonder when someone comes in our door and they're not from here, what brings people to our community?
I would say family.
Yeah, so usually there's a tie already here, friend or family member.
Yeah, I've been here 23 years. My uncle's the first Puerto Rican man in Greencastle, and he's been there 45 years. So if it wasn't for him, I would have never known about this town. I've been coming here since I was 11 from New York. So he gave me the opportunity to do my life better here, and that's what I did. And if you speak to the majority of people, it's mostly family or someone helping someone. It's experience.
So I wanted to go back a step a little bit. If you are in the lens of someone that's maybe needing to seek help for the first time, what should they do? Where should they start first? Because there's just so much. And so what would you say to someone that maybe needs to access help for the first time?
Can I take this one?
Yeah, go
I
ahead.
say make a list.
Okay.
Make a list of the top 10 things that you need. I just had a case with a single mom. She's brand new to Franklin County. I said, give me a list of 10 things that you need. And she did. I said, we'll do baby steps first. The first thing was her health because she needed it. I said, okay, we'll do that. The second thing is her kids, making sure they have winter gear for later. Third thing is getting food. That's what I tell my clients. Let's work on goals. Let's make a list. Once that's done, we create another list. That's how I do it. What you do?
Yeah, I think SCCAP's a great starting point because we have so many resources there, and to be able to meet with somebody to do that list, like what's your priority, and then we can make those connections.
Maybe someone comes in with one problem, their immediate needs, I need a place to stay. But then as you have the conversation, you realize they might need all these other services. So that's something really interesting. Could you kind of touch on maybe more of like the wraparound services that like SCCAP provides, or Desi, you obviously provide?
Well, okay. Well, Keystone has a lot of practitioners. When someone says I need help with I need medical needs, and I said, I got you. The first thing I ask them if they have insurance, they say no problem. We have a reduced fee program that goes by your income. So if they say they need anything when it comes to health, feet, pharmacy, women, children, I make sure I help them. We make appointments. I let them know the locations. I give them our Keystone community. I say yellow pages with all our information. I have it in English and Spanish. But I definitely hold their hand. I make sure I do everything for them. Once I know they are established patient, we're good to go, I pull back a little bit. Because there's only so much you could do when it comes to patients and clients. You can only hold their hand so far.
Right. Then they have to follow through
Yes.
and take the appointments
Yes,
and
because
go from there.
Yeah, I have to show them some responsibilities. Now, I will say when it comes to my Spanish population, we have hard time reading and writing. So I help them. I show them pictures like this is the building. You don't want to miss your appointment. That's how I do my education when it comes to that.
For us, like, you don't know what you don't know. So I'm having a conversation with people, especially when they're behind on their rent. And now I'm like to the point where I think there might be a rental assistance program that we can help with. And so I have to go through their budget because they have to be sustainable for this program. And it can be invasive. It doesn't feel great to be like, what do you spend all your money on? And I'm like, I'm not judging. I just need to know because our program requires this. But when they're like, when I have to ask what your internet is, and they're like, oh, I spend $100 on my internet/Wi-Fi, and I'm like, where do your kids go to school? Do they get free reduced lunch? And they're like, oh yeah. I'm like, do you know about Internet Essentials where you can get it for $15 a month instead?
I bet a lot of light bulbs go on.
Yeah. Which is why I take a lot of notes, because as people are talking, I'm seeing some things that they may not be aware of before, and sometimes they are, and then it comes up to what the barrier was to why they can't get that. But I'm like, oh, well, here's, go see Desi down there, or if you don't mind, can I give your name and number to Desi and she'll give you a call, or to this person over here. We have a great connection at CareerLink. Susan there, we will often get you hooked up on CareerLink, and we can send your name and contact information to Susan, and she'll make your resume look all pretty, and then she'll start sending you some jobs of where you want to work. Like, I'm tired of the warehouse. Let's get you where your passion is now for it. So it's nice to write and think of all these resources in the community that we can share then.
That is one thing that I'm somewhat new to the community, coming up on 3 years, and getting to know our nonprofit community in particular. Everyone's very collaborative, and we all are working towards the same thing. We want to work together to help our community, and it's great to just see it in action, 2 different organizations and how they collaborate, and any way that we can help highlight that, and what could we do better too. And that's another reason that we want to sit down, and is there things that we could do to help make connections with other organizations?
I will have to say sharing the proper information. Yes, because there's a lot of miscommunication with a lot of nonprofit organizations and how they run and how they do their services. There's organizations that have boundaries with county. Like for me, my counties are Adams, Fulton, and Franklin County. Unfortunately, I can't go to Cumberland, but I will show them some love whenever they need it.
Right.
And it's sad, but that's how we are. Those are our grants, and we have certain population we have to hit.
And honestly, I think you just hit the nail on the head. A lot of times what drives our work is the restrictions of the funding.
Yes.
And often that's a hard line.
Yeah, no, it is. And it's sad, though, because we could help them, but we just can't.
So here's a question. Do you find that when people come to you, they're often a little anxious, or there's a fear? And how do you deal with that?
I say both, and frustrated too.
Yeah.
Yeah,
I see more frustration with clients coming into my door because, especially if there's a language barrier, they get frustrated because they don't understand. They don't know what's going on. They don't know who to look for help. And when they come to me, I reassure them. I said, things are going to take time. I do let them know I can't make no promises. That's one thing I will tell you as a community healthcare worker. No promises with me. I will try my best, and that's what matters. I make them feel comfortable. I don't dress in normal gear, just with my sneakers and some felines. And I just try to be natural, like that it could feel comfortable when they come to my area. Or if they don't want to come to my office, I will meet them in a public space, in the library, at their homes. Because it's kind of intimidating asking for help in the street. Going to an organization that you don't know, speaking to someone of a different color. So definitely, that's how, those are my challenges. What about yours?
Yeah, I think it's not easy to ask for help when you're struggling.
Yeah.
For anybody. So there's some anxious in life for all of us, gets overwhelming. So when they come in, and that's usually the time I'm pointing out their strengths to them. Like it took courage to even come here and ask for this, and whether we can financially help or not, we are here for you to figure this out together. And you've made it work up to this point so far, so you've been doing it, like whether you realize it or not, you've been making it work. And we all need a little bit of help sometimes, and we're just here to,
when I see single moms, because I'm a single mom, but when I see them going through struggles and they can't make it, I encourage them. I talk to them. I said, if I did it, you could do it. I said, yes, there's a lot of help out there. You just have to look for it. And especially my young moms, I talk to them. I say, you guys have it different. From when I was growing up with my kids, there wasn't a lot of services. Now there's so much. You just got to know how to get it. You got to do the right protocols to get these services. I give them a hug. If I see they're depressed and down, they cry, I ask them. I'm like, you want a hug for comfort? I let them know that there's other people out there struggling, no matter if we're professionals or not. And it feels good when you can relate to their status. That's another thing.
Just saying, I get it. I've been there. Matters. Yeah. Like Desi said, she's a single mom. I'm a single mom. So many of our clients tend to be single moms, and to be like, I get the struggles either with just dealing with an ex or trying to support, and trying to find time with your kids and making sure your kids have a good birthday. Like we've all been there for it, and it's not just those, for us anyway, it's not just those in poverty. It is that Alice population that are that lower middle class people who just hit a snag in a road, like they didn't have the PTO or the sick bank, and they got sick, or a car broke down and they missed work, which led to just one missed paycheck, which can put you behind and have to decide what bill you're going to pay, and it just snowballs.
So just to pause there for a second, in case you're not already familiar with Alice population, we've done a lot of study into the Alice population because a lot of times the people we're serving are Alice, which stands for Asset Limited, Income Constrained Employed. What that means is people are working, they're doing everything they can to try to stay on track, and things just aren't adding up in a way that helps them make ends meet. And so that's exactly, Melissa, what you're referencing, is that maybe single mom, single dad, or even just head of a household that's coming in and they can't quite make it, right?
Right.
So, question for you: how can someone who maybe they're listening now and they need the help, how can they best prepare to come in to have a conversation? Or if they're gonna pick up the call and call 211 or call the county for help, what do they need to have? What's the best thing to have together before you make that call?
Know your information. Know what you want. Know what your needs. There's a difference between wants and needs. You want to do your needs first before your wants. Know your address. Know your county. If it's for medical needs, please know your diagnosis. It's all about people educating themselves now, because I feel life skills has totally left since COVID, and I need people to know more about themselves. Know what doctors you go to if you have high blood pressure, if you have diabetes. Know the name of the school that your kids are going to. Inform yourself, educate yourself before you start calling for help, because it makes it much easier for us, for Melissa, when it comes to filling out paperwork or to guide our clients or patients to the path that they need to go.
Yeah, I think especially 211 calling, that they do ask if you have a mental health diagnosis or anything, because there are other agencies that can help in those areas if you have certain diagnoses, or whether you have income or not, and what county you live in is a big thing.
It's a big thing, yes.
Because
just to know where to refer someone.
Right.
Yes.
I know for us, all of our work is in Franklin County, and so that's most of the time, if somebody calls us, I'm asking what town they live in so I can figure out what
First
services.
question is, what town do you live in? Yeah. And then if it's Shippensburg or Fayetteville, I'm binging it to see, because Bing gives you the county map on the address and where they're at.
Yeah.
And so I can do the appropriate referrals. And we have connections in Cumberland County and Adams County that we at SCCAP can make those direct connections.
That's right, because you all are both reaching outside the county, which is helpful.
Yes. Yeah, we have the Keystone Migrant Program in Adams County. So I have, we're everywhere. I am everywhere.
And we're fortunate that SCCAP does have has an office in Adams County. Also serves Adams County. We just don't have the rental assistance program in Adams County that Franklin County has, at least not through SCCAP anyway.
And another question, just based on calls we see, because it seems like typically when someone decides to push the button and say, hey, I'm in crisis, it's because they've either been evicted or they're about to be evicted, they're about to lose their place to stay. So how do you work with that? Because I'm hearing you both say the same thing I experienced. Housing is extremely difficult.
Well, it's also how you define crisis, too. We have crisis for housing. We have crisis for mental health. We have crisis. So we have to be careful how we use the word crisis and the word homeless, because now homeless has changed in many different ways. You have people living in the shed, cars, the way they're making living now to be outside, it's easy, but people are not used to that. So when it comes to crisis, we have to be very careful using that word. Now, when it comes to mental health in crisis, if you need behavioral health right away and you see that the child or adult is in need, then you call your crisis. But don't call them because you can't get into behavioral health and it takes you 2.5 years. It's for you to look for other organizations that are willing to take you. Look for other counseling service, peer services. There's hotlines out there. Am I right, Melissa?
Yeah.
There's a lot of support groups. People just got to go out there and get it.
But a lot of people aren't, when they're calling in that crisis moment, because I'm going to be locked out in 2 days.
They don't know where to get it.
They don't know.
Yeah.
And it's not, I can't help you. At that point, I can have a conversation. We can talk to your landlord if you would qualify for financial assistance, to see if they will be willing to wait on that lockout till we can figure this out. But it's harder for me and us providers to be able to help with that quick.
But that's not a crisis moment, though.
So and that's what we Yeah. Your crisis is not my crisis, but I can help you at least mitigate that. And the fact of the matter is, you might be locked out because you might not qualify for financial assistance. And also, let's figure out who's in your circle and where else can you go.
Yep.
If it comes down to that, you are
because
going
that's
to
not the answer anyone wants to give.
No, it's not.
It's never the answer any of us want to give is, that we may not be able to help you right now, but the reality is when you've already been evicted, you're within 2 days of being evicted, it's nearly an impossible lift to try to solve that problem. The reality is the funding's not there to do it.
Right.
And so the question is, what do we do at that point? How do we step in, and what can the person do to meet us partway so we can help them the best we can?
I think being open-minded and really looking at, we will sit down, we have this tool called Who's in My Circle, and it's your friends, your family, your coworkers, your place of worship, other agencies in the area, your school, your children's school, anybody that you can think of that might be able to do some sort of help you out in some way, whether it's your kids can stay with them for a few days, and maybe you do have to stay in your car, maybe you can stay at your aunt's and your kids can stay at their best friend's house.
It's survival.
Yeah,
point
at
blank.
that point.
It's all about surviving and coming up with a game plan.
But we're not going to close the door on them just because we can't solve it financially right now. We're going to be there to help you look
to try to find a solution.
Some solution.
Some resolution
for it. And I'm like, the moment you start falling behind and anything, come see us, because that gives us so much more time to work. It takes some of the stress off of your plate.
Yes.
Let us take some of that burden on, so we can get this figured out before time. It takes a month and a half to actually evict somebody from a legal standpoint. And now if you find out you're going to fall behind next month, like you're struggling to pay that rent, come see us now in January if you're going to struggle with February, because maybe I can figure out how you can pay February, and we can figure out some of these other areas
budgeting
in the meantime.
So let's talk about what that looks like, because that's a different world. If you're a month and you're struggling right now, you're coming in, and a month from now I may not be able to make rent, which probably is a month from now. It doesn't look like everything's going to add up and I'm going to be able to make it, right?
Mm-hmm.
What do I do at that point?
Well, I've been telling people, let's make some cuts, especially like with apps. If you have so many streaming apps, cut some of the apps down. If you have food stamps, let's see how we could shop with food stamps the correct way that we spoke about. Make it last longer. Shop with coupons. I know it's kind of embarrassing when people ask, but you got to budget. If we want to make that money for next month, you got to make some choices. Give a little bit here, take a little bit there, and sometimes it's hard for them to do that.
So sometimes there's just not anything to cut. Like
yes.
They're doing it all the time. But the one thing I ask is what changed that you're going to be struggling to meet this rent this month, because that's usually the key piece where we can figure out how to prevent that from happening in the future. Was it an unexpected car payment, an unexpected medical bill? And so let's figure it out. Like, we're not going to be able to help you financially the month because you're not at that point yet. You're not being evicted. There's no notice to quit, but we can help you maintain to stay on track, and prioritize some of those other areas. And then if it was because of a vehicle repair, like, let's figure out how we can get that income. Like, unfortunately, it is generally an increase of income or a savings, so that should that happen again and down the line in a few months or in 5 years from now, even, that you're not back in this position
right
again, because nobody wants to be back in that position. They would love to be able to not
You're
do
such a
that
good
again,
person.
but they don't.
I wouldn't.
They don't, you don't know what you don't know. And so let's look at the cause of this and to figure this out.
And that's wonderful, because it's like you want to help solve that immediate need, not necessarily a crisis, but that immediate need. But then how do you help guide and work alongside someone to get them to that next step, so they're not always having to be in that cycle.
Right.
And that's great that you kind of help make that plan and help them look at the bigger picture, because a lot of times, especially when we get people calling in, it's so narrow focused, like there's just this one thing, but there's all these other things that you can bring into the picture. And so thank you guys for being able to help bring that perspective and all of the services together, because it's a lot, and it's a lot for one person to do on their own. So we're thankful to have you guys helping in that capacity.
Well, I want to thank you both for spending time with us, educating us about the services that you're providing, how you're connecting people. Hopefully, if you're listening, you learned a little bit about the work they do to try to connect people, and what it takes to bring all that together. And we certainly appreciate it.
Yeah, thank you
for
so
having
much.
Thank you for having us. I'm very excited. I hope this goes well and you hear from me more.
Me too. Thanks for tuning in to United We Listen. If you heard things today that make a difference in your life, or if you think will make a difference for our community, please consider making a donation to United Way of Franklin County. You can visit us on the website at www.uwfcpa.org. This podcast is for information and entertainment purposes. Before making financial or medical decisions, please consult a professional you trust. If you like our content, please like, share, or subscribe, or consider a donation to United Way of Franklin County. Look for a link to our website on the platform you are using to listen.